So Eva was kind enough, I reached out to a contact at Harvard and I said, we need the lighting expert in public health. Here she is. Eva has a very long resume and is attached to a number of very prestigious universities, but a particular instance in what she's going to talk to us more about is her research in the circadian rhythm and its connection to chronic disease. And in particular, if you remember in the documentary, the part about night shift work and the nurses study that I think is kind of mentioned in there, barely. But Eva will talk more about that as well.
Sure.
And I'll let you drive.
Yes, so where do you start here? What a beautiful movie, wasn't it? I just thought it was like a painting that was describing the dark night sky. Can you hear me all right? It sounds a little weird.
You're good.
It's good?
You have to hold it closer. Hold it closer.
Yeah, I should eat the micro.
Yes.
Well, so to me, while I really enjoyed the movie from a mystical, almost like artistic standpoint, I did also find it very confusing. In the end, I was like, wow, there's so many things to light. Where do you start, right? There's good things to light. It gives us security. It can help us to overcome maybe seasonal affective disorder. So many other things they discussed in the movie. And then there are all these negative aspects. And how much weight do you place on which of these negative aspects? So I will focus on the aspects of light on health in particular. And I will discuss a few of the mechanisms that underlie the potentially negative health effects of light exposure at night in particular. But before I start and give you a little bit of an overview, I do want to point out that there are actually geographic areas on this earth where people are exposed to constant light for a couple of months a year in the Nordic regions, and they don't pass away immediately. They survive and they're fine. So I think you don't have to be totally worried about light exposure. But let me show you what we have done in the past. And I do want to set out by emphasizing the importance of circadian rhythms. Rhythms is what has fascinated us the most and has not been discussed at all in the movie. If you look at this slide here, circadian rhythms, roughly 24-hour rhythms, govern our bodies. If you see here, almost every function in our body follows a 24-hour rhythm. The best example is the sleep-wake cycle. It repeats itself every 24 hours. People go to bed at night. But while you sleep, your blood pressure drops, your body temperature drops, certain hormones are secreted in a 24-hour fashion. The immune system follows a 24-hour rhythm. So there are many, many things that follow a 24-hour rhythm, and those rhythms are not unique to us humans. They also exist in plants. If you think about the closing of buds in the evening when the sun sets, and the opening of flowers in the morning, and animals also follow 24-hour rhythms. So this is something evolutionary, very old, and very universal across all species. And here, just to emphasize how many different areas in our body are impacted by these 24-hour rhythms, including gene expression here, which also has these distinct rhythms. And then the sleep-wake cycle is the most important of these rhythms. We are also only recently understanding how complex this governance is. There are genes, clock genes that we now have learned that are regulating these 24-hour rhythms. And there are important pathways that we are unraveling right now that are also directing this 24-hour rhythm. And this is a very dense but really good summary of what's going on. How do these 24-hour rhythms evolve and how are they regulated? You can see the eye. The eye is important. In the film, Bud Brainard was talking. He is actually the person who discovered the retinal receptor that's responsible for how our brain can be informed about environmental light exposure. This was only in 2003, so it's all very new science that you are seeing here. And it was an important discovery because it implies that light from the outside can actually change and impact our internal clock, is how I would like to refer to it. The internal clock is in the hypothalamus. It's not more than a bunch of neurons that regulates our 24-hour rhythms. People call it the suprachiasmatic nuclei, the biologic clock, the internal clock. It's located in the hypothalamus, and it's going to be directed by light exposure that falls onto this particular retinal receptor, which is not a rod and not a cone, so not responsible for visual, but for circadian transformation of information. And what is also of note is that in blind individuals, this third receptor often works. Only about 20% of blinds don't have this receptor, and that's usually if the retina is no longer in place or the eyeball has been removed. If the retina is in place, blinds may not have a visually functioning system, but they always have a circadian functioning system and can stay in sync with the environmental light surrounding them. And so the circadian system then will trigger melatonin secretion. Melatonin is a hormone which many of you may have heard, and you can actually buy it and ingest it. And it very closely tracks our sleep. So people use it as a sleep aid or to have overcome jet lag, for instance. And we think about it as a marker for the circadian system. But it also has a couple of interesting properties relating to cancer protection, but also to the cardiovascular system and metabolism. A question that I want to raise, and maybe we can discuss later, is because I imagine that several of you in the audience here might be concerned about how can light at night, especially if it's very bright outside of our sleeping windows, impact the circadian system. And what I do want to point out is that when the eyelids are closed, nature has really thought everything through. The eyelids form a natural barrier that's sort of supposed to filter out that specific wavelength that has the strongest impact on our circadian system. It was Bud Brainard who found out that this particular wavelength is somewhere between 460 and 480 nanometers. It's very blue light, and because you have vessels in your eyelid, you close them, you will have a natural filter and barrier for these very short wavelength light, unless, of course, they are very, very strong. So theoretically, when you sleep, unless the light is very strong in your room, you should be protected from light exposure. And we can discuss this more later. But what we were interested, given these mechanisms, is what happens if a person doesn't have their eyes closed at night and doesn't have this natural barrier. What if they are exposed to light with open eyes? And these are typically shift workers. So we have focused on this population as a particularly high-risk population where it's clear that they will experience the mechanisms that we think underlie any potential health effects. And I was just fortunate to have these resources at hand and have made use as much as I could over the last 15 years. These are 3 cohort studies with a total of almost 300,000 nurses, and 60% of them have worked night shifts. So really unique and probably worldwide the best resource to study the effects of shift work on health. And we have begun looking at cancer risks. We found several different cancers elevated in these women. And this has led in 2007 already WHO to classify shift work as a probable class 2A carcinogen. And this classification has led to payments in Denmark, which is the only country that reacts to class 2A carcinogens and compensates nurses who have developed breast cancer on their job as considering as an occupational disease. In the meantime, we have published many, many papers. We have solidified the evidence for cancer, for different cancers. The groups that have epidemiological data in other places in the world on men, which we don't have, we always only studied women, did show also prostate cancer and colon cancer and other cancers elevated in men as well. So this is not universal to women. And we have slowly moved to other endpoints. We have now found that type 2 diabetes, hypertension, cardiovascular disease are all elevated in shift workers. So with this knowledge, we are beginning to kind of try to look a little more closely at whether there are individual factors that determine whether someone does not develop cancer or any other chronic disease as they work night shifts. And there seem to be some specific things that some individuals may harbor that make them more prone to develop the disease. One aspect is a genetic susceptibility. We have done this one study, which is waiting to be replicated by another group, where we see that a particular clock gene, if you have a variant in that gene, you are, even after 2 years of night shift, already at a double higher risk of developing breast cancer, when typically we see risks with cancer emerging only after 10, 15 years. So this particular variant seems very interesting. Another aspect that we're beginning to study now is chronotype. All of you are different chronotypes, some may be morning types, some evening types, and whether or not you are an evening or a morning type is very nicely distributed across the population. So most people are somewhere in the middle, but there is a fair amount of night owls and a fair amount of early larks. And what we see in our more recent studies is that whether or not you are such an early or evening type, the work schedule that you will follow will have a different impact on you. And you can see that, for instance, if an evening type works night shifts, they do fairly well. Whereas if a morning type works night shifts, that's much worse. And opposite is also true. And we do see this now translating into disease risks. So we see that, for instance, type 2 diabetes is higher in morning types who work night shifts and in evening types who work day shifts or early morning shifts. And we see the same for cardiovascular disease. And there are now some more studies beginning to come out that have looked at this in cancer. We also see that the risks that we observe seem to go away after a few years if people quit working night shifts. And we are in the process of trying to figure out what preventive implications this may have. And I'm listing just a few, which we may want to discuss later. Lighting sources, of course, could be one, and I imagine we will hear more about this. And then, of course, melatonin supplementation, a highly debated potential preventive measure. I think this is it. Those are all the people who have done much of this work in the last 15 years.
Great. Thank you. Jen, I think you need to get something. So, Jen, as if she needs an introduction. Thank you, Eva, by the way. Is Manager of Sustainability and Environmental Affairs at OSRAM SYLVANIA. And Jen and I have known each other for a number of years, and we were at Elizabeth's sustainability dinner. Elizabeth Henry is in here someplace. I can't see her right now, back there. And I think I was probably waxing on about this movie, The City Dark and Light, and Jen mentioned that she has a presentation that she does called The Future of Light. And it was a really interesting conversation because I think traditionally, especially in the sustainability and CSR realm, we spend a lot of time thinking about light. I'm looking at you, Greg. Thinking about efficiency and cost savings as it relates to buildings and other aspects, maybe emissions from different things in buildings that affect health. But this connection, that the fact of light, or maybe when our employees are working, is part of this as well. All comes into play, and I thought, okay, I'm gonna marry these two into this presentation. So Eva mentioned blue light a little bit. Blue light was mentioned also in the very early slides that Kelly provided, because that's a new installation in Milan. And how many of us have at least exposed ourselves to one article about blue light recently and its impact? And how, no, not the blue light special at Kmart, Carol, but but blue light as relates to our screens and how soon we should put those things away before we try to go to sleep at night. So enter Jen Dolin to talk to us about the innovation of lighting and where that's taking us. Jen.
All right. Well, I feel like there's huge expectations. So
There is.
yeah. Oh, great. Okay. So the obligatory. All right. Before we get to that, so focus on that. Okay. So what I'm going to talk about is a little bit different, but just to kind of bridge that gap. Question is, okay, heard all of that phenomenal, information about light and health and the studies and et cetera. So then the question is, so is anybody actually doing something about it? Before I get to what the lighting manufacturers are doing, Yes, there are organizations that are looking at using light to overcome jet lag, and in fact, the Red Sox increase the lighting in their clubhouses for their incoming guests to overcome jet lag. Except when the Yankees are coming from the West Coast, believe it or not, they turn the lights down in their clubhouse. Just kidding. But anyway, okay. So moving on, I am going to give you a little bit of where lighting is going, and light and health is a big issue, a big topic that manufacturers are looking into. I think we certainly could be doing it a little bit more. We'll see where that goes, but my presentation doesn't quite touch on light and health. I'll take you in a different direction. I had a obligatory slide. These are just kind of some fun facts about our company. Again, obligatory slide. What? Oh, I think I'm in animation mode. Okay, so hopefully this doesn't move on me. Okay. This is what St. Peter's Square looked like in 2005. Look at the lighting. It's focused on the architectural lighting way down at the end, right? And then flash forward. This is where lighting is now. Everyone's got a screen. Everyone's looking not at the actual, events, activities. They're looking at a screen. And that is the blue light, the problem that we were talking about before. Lighting has evolved. This is where our lighting handbook, Glenn would recognize this. This is just to show you how much more there is now in lighting over, this is the 9th edition and the 10th edition. This is all because of LED technology. So lighting in the future, hopefully also light and health would be thrown in here, but right now what we're seeing is that these are the 4 factors shaping the future of lighting. Energy costs, standards and regulations, which also include codes, current trends, which I'll show you, and then changes in technology, shifting to LED. So these are very intense. I'm not reading these, but this basically says, yeah, electricity is skyrocketing. It's not going down. The cost of electricity, even though we're shifting to more renewables, the price of electricity will not dramatically go down. So what do we do about that? More energy efficient products. Again, eye chart, what you want to see is the numbers keep going down. This is the amount, the lumens per watt, the amount of light coming out per the amount of energy going in. In a building, the design for the lighting keeps going down. We have to use less energy for basically the same or more light. That's what that shows. Regulations. The federal government is throwing more and more regulations at us for energy, for lighting. Lamps have to be more efficient, using less light. In fact, sometimes, not less light, more efficient using less energy. And in some cases, certain technologies are being regulated out of existence. Not necessarily a bad thing, but a lot of that is because of the new technologies that are coming out. That's not ending anytime soon either. Hopefully it will, but we're working on that, but that's diminishing returns on that one. So everything right now is converging with lighting. You're seeing everything's getting smaller. We've got more wireless capabilities. Solid state lighting is another way of saying LED. You didn't know that. So all of these things are just, globally we're seeing companies and products and everything coming out. Everything's converging. Lighting's at a very exciting time. Okay, so this is an example of what I mean by, a very exciting time. These are different light sources, and the years that they were invented or really hit the market. On the left-hand side, you'll see the efficacy, lumens per watt, like I was telling you before. The dot is the year of invention, and you can see those trend lines. So at the bottom, incandescent didn't really improve in the efficacy, whereas the fluorescent has increased over time, metal halides, a little bit more. And now you introduce LED. Whoops, or we don't. Let's introduce LED. Okay, so in 2000, pretty much when it really hit the market, other than maybe exit science or something, you can see that increase in efficacy, up to 100 lumens per watt in 2012. And here's in 3 more years, we doubled that. So that is, the future of lighting pretty much is the LED technology. This is an LED. For those who don't know, I'm sure everyone does, but I brought a few. These are LED packages, so they are, well, essentially these would go, I'm going to pass these around, feel free to look at them. What you're seeing in here is a tinier version of what you see on the right-hand side here. The LED itself, the actual semiconductor chip, is the tiny box on the person's finger. And what you're seeing going around is what's called an LED package. That's what goes into your, your little, keychain light, that kind of thing. And what we do with those is we take the chip, the package. You can see again, it's the same thing that I'm passing around on the left, and that goes onto what we call a board. And the board doesn't have to be a hard board anymore. Board can be tape, it can be flexible. LEDs are tiny. We use them, we can put them anywhere, direct them anywhere. The next one, heat sink, kind of is a bit of an older slide, because at one point LEDs were very hot. They needed to have a heat sink to draw the heat away from the electronics. Well, innovation has made LEDs a whole lot cooler, so we barely need a lot of that heat sink. Then you put optics on it, direct the light where you want it to go, and only where you want it to go. Add power supply and controls. You can't just plug in an LED. And LEDs are very controllable. You can dim them, you can program them. You can then put them into a lamp or a fixture. So these are the steps to get from what I'm sending around to something overhead, something outside, something like what we saw in the beginning. Okay, but keep in mind, they also lose efficacy over time. That's where we're working on increasing that over where I showed you the projection going up. That is the individual chip. To get to the final product, it's a little bit less. Okay, so question for you, what do you expect from a light bulb? Light. Anything else?
Instant on.
Instant on. What? Controllability.
Oh, it's safety.
Safety.
Durability.
Durability.
Color of the light.
Color of the light. Okay. Everyone's thinking lighting. And here is the future. Keep in mind, I said that these are semiconductor chips. So what do you expect from your phone, your computer? Information. A whole lot more than you had 6 months ago, 10 years ago, right? Okay. We're able to print LEDs. We can print lighting. Believe it or not. We can take lighting, integrate it into the ceiling panels, so a building owner or a building manager can rent out new space. You used to have to, if you wanted to reconfigure your space, you'd have to actually reconfigure the ceiling, or you were just basically stuck with the cans you have in the ceiling, right? Now you can take the panels and move them around. New tenant, different use of that space. You have higher rent, or at least, more flexibility. Okay, imagine, we're so used to our smartphones, and we call them smartphones. Well, every building has to have lighting, right? Well, why not use that lighting for something more than just lighting? So imagine you're going into a store and you hate shopping. My daughter can't imagine that, but people hate shopping. So you just want to know where the shoe department is, right? So you take out your phone, or maybe you've been on the site before, and because of the location and the lighting, and it's got sensors in there, and it's communicating with your phone and the app, it's going to direct you immediately to your shoe department. Because it's got Wi-Fi repeaters, it's got GPS essentially, that kind of stuff. Anyway, I don't exactly know what they're integrating in there, but essentially it could guide shoppers to exactly where they want to go, in and out, helps the retailers, helps the consumers. Okay. Imagine if has anybody been to an airport where they see the gate directions on the floor? And you think, okay, well, it's projected from the ceiling. What if you can weave it into the fabric? So it's being lit as you're walking. Turned off when nobody's around. Right? So I love this quote. Nope. Normal people, if you can't read it, normal people believe that if it's not broken, don't fix it. Power electronics engineers believe if it's not broken, it doesn't have enough features yet. What can we do with lighting? What else can we do with lighting? And this is from the Department of Energy. LEDs are the future of lighting. You can see LEDs that are the top green. You can't see this weird colors. Incandescents being phased out, have been phased out. They're on the downward trend. Fluorescent, downward trend. The only thing here that's on the upward trend are LEDs. So that one is actually 2 years ago. Okay, so just some fun things, just to show you more stuff you can do with lighting. I just thought I'd end with some fun photos. LEDs, color changing, and life. So that's, yes, this one, I don't know. This is a national stadium, and they have different settings and different programs. So people who are from Poland, from Warsaw, know that as they're driving by, if the lighting is of a particular scene that they're looking at a particular scene, they know that their team scored a goal. So they use it as a means of communication. And this is what it looks like on the inside. So they can set it, I don't know how many, we've got dozens and dozens of settings. And LEDs are starting to be integrated into sports lighting, primarily, not because of energy savings, but that is a huge, huge benefit when you're cleaning a stadium or an arena, and you don't need every single light, but you just need enough light to clean for the 2 hours after people have left. You can dim the LEDs. You can't really dim the HID lamps. Also, most importantly, HID lighting is not compatible with HD television. And they were finding, if anybody's noticed, you watch a basketball game, watch hockey, and they do slow motion, see the strobing in the back. You can even see that outside. But that's one of the reasons why they are moving to LED lighting, among others. All right, and I think, yep, and it's not just, so that's it.
Okay, thank you. Just going to get to a slide that's about questions. There's a lot more, like if you ever want to dig into LEDs that Jen can explain. But all right, I'm sitting here thinking, okay, that's the future of lighting. Is that good for public health? Right? It sounds like it's good for building managers, cost efficiency and such. Sounds like it's good for people who want to sell product. I'm guessing, though, that there's the trade-offs to me sound like if you can put light everywhere, maybe that's not good after the documentary we just watched. And Eva, I think you had some comments. So I just want to reinforce before we get into this that this is a conversation among all of you, not just to be a Q&A with Jen and Eva, but we have experts in the room. We know that in Massachusetts, I think it's close to 40 municipalities now. I don't know which expert in the room I'm looking to right now, but about 40 communities have passed lighting ordinances to reduce light pollution. No? Not 40?
No, not Cambridge.
Oh, not Cambridge. but there are others as well. There are others who have, right? So there's a trend there. And so more lights everywhere, maybe less demand from other places. What's the impact also on public health?
Well, the one thing that I will say about LED technology, which I probably should have said before, is that LEDs are very controllable, very directional. So we can use them only where we need them, only when we need them. And that's a huge benefit. Different traditional technologies have pros and cons. Not all of them are as controllable as LEDs. I mean, LEDs aren't the silver bullet, but as we convert from traditional to LED, we actually can use less light. We can use it only where and when we need it. So that is a huge benefit that is outside.
And we know that there's a design question. So I see Bob, but I want to hear Eva first. Okay, so what does health tell us about blue light?
Well, I think Jen's talk was really interesting because she did not go into the health corner, and I appreciated it because I think there are way too many unknowns from my perspective today. As some people from the lighting industry do, they develop things and then imply that this would be beneficial for health when we don't know whether it would be. And one example that I just want to throw out there for people to think about is that our system is adaptable. So, for instance, if it's very bright throughout the day, we should send kids out in the sunlight, right? Everyone knows that, so they go outside and have their light exposure, and then they usually sleep really well. And there is a potential that this relates to how much light you were exposed to during the day, will then also impact how susceptible you are to light in the evening. And so it may not matter as much how dark it is in the room of a child because it's been exposed to so much light during the day that even light amounts of light don't bother it. And as we get older, we don't go out as much anymore. We don't have this big difference between a lot of light during the day, most kids nowadays neither, by the way, because they stay home, and then very dark in the evening. So this is an area that we don't really understand yet fully. There are some suggestions that it matters how much light you are exposed to, and how quickly you can then either adjust to darker environments or be susceptible to too much light in the darkness. And I think this would be something that the lighting industry could pick up really easily because you can sort of, with artificial light, direct the differences that we have between day and night. And if that turns out to be really important, it could be a nice way for the lighting industry to help us with our health.
Are people starting to study the impacts of blue light and things like that? Are those studies happening, or are they yet to come because this is evolving so quickly?
This is starting slowly. It's hard because you actually need to measure light exposure, so you can only do it in small groups of individuals. There are light meter studies, actigraphy studies, where you try to measure light exposure, and they all sort of suggest that it's the shorter wavelength light, and the shorter the wavelength, the shorter the amount of time is necessary that your melatonin level and circadian system will be suppressed. So if you're exposed to candlelight, it will take a few hours for your circadian system to be suppressed, whereas for a halogen lamp, within a minute, if you get up at night and turn on the light, your circadian system will already be affected. So the wavelength determines how quickly your circadian system will be effect, and it would be more advantageous for, let's say, night lamps to be more long wavelength lights, or to have adjustable lamps, right, that can be short wavelength for the day and then at night turn into something more long wavelength. Is that a possibility for the lighting industry?
Yeah, actually, we do have those. There are a lot of the, what we call the tunable lighting lamps that change color, temperature with an app. Those are available. And
So hopefully
Yeah.
with more light comes smarter lights, right? Okay, Bob, you had
So
your
it's sort
hand.
of like Walmart going back to saying, well, everything's in the supply chain. Don't worry about us, don't look about us, it's not supply chain. Well, with all those LED lights going up, and you saw the great big curve there, the active element is made from sodium and sodium metal. So if you take sodium metal and you expose it to air with a little bit of humidity, it blows up. We blew up a person here in Massachusetts, in North Andover, a little bit less than a year ago. We seriously burned several people at Dow Chemical, who makes those LED activating things in there. So there's going to be this whole issue of, as we go into another new field, who's producing all that sodium? How many people are dying of all these accidents? Because they really sort of suppressed that was LED. It was specifically, what it was, the package was damaged. And he lift the package up, some humidity got in there and just blew them up. And had that blown up in the truck, other people would have been killed. So, so there are these issues, especially when you're going exponentially up. You're not looking down the supply chain and seeing what the impacts are going to be to people. And I'm a chemist, and we used to do those sodium explosions in the classroom. You can't do them anymore. Now they have them on YouTube, which is pretty good, but the kids are still trying to go out and get the sodium metal. But it's pretty neat. You just take it and throw it in water, and kaboom! It just blows up.
Not good to throw. Not good when it happens to a person though. So
Yeah.
point
The other thing
being,
is,
there's
the
there's
green
potentially
chemicals,
other
almost
health
all the
impacts.
green chemicals produce hazardous waste when you make them. They're green at the end, but they're now discounting the reaction to those. So you go to one at Babcock, and they got all the hazardous chemical rooms and things like that, and you're saying, well, gee, this is the green chemistry place, and they make green chemistry from hazardous materials.
I just want to go to really basic stuff like shielding light and making it go down. It seems to me that this is an issue that we could get on immediately. We don't need further study. I was just totally dismayed in the movie that Jones Beach from 1970 to today is unusable for astronomy. I mean, Jones Beach is a beach off in the middle of nowhere. It's like, it's absolutely unacceptable that amount of light be everywhere. So we need to be shielding everything, and Cambridge needs to be shielding everything, and every city needs to be shielding everything. And that French guy, or whoever he was, who was putting all the lights on the high, I mean, it's like, come on, this is really, really important. And I'm sure there will be additional health benefits from it, and additional everything benefits from it, and I love LEDs, and I think they're great, but we've got to get less light up and more light down, and the time to do it is now. And let's really get active on it.
So Glenn, not to cold call you, but to cold call you. Would you like to comment on lighting design? Right. So the documentary does state that so much of this is about design and lighting design. And have you seen a trend in folks picking up on the fact that maybe what was good in terms of lighting design at one point, has it been evolving? Can you enlighten us about this, or where the trend might be happening?
Well, there's certainly a lot more understanding and sensitivity to light pollution and the effects of light and health in the light design community. I mean, some lighting designers are more knowledgeable and sensitive than others, but that's been a huge move in the last 10 years. Mainly because we just learned about light and health effects. That's all new. And that's a big issue in lighting design right now. And the light pollution has been a big issue. And so we're all responding to it. And good lighting designers are designing sensitively. In other words, our goal is to minimize the negative, provide high quality environments, interior or exterior, but with minimal environmental impact. So that means minimal energy use, minimal light pollution, and we're trying to figure out how to make sure we're not doing health damage, but it's very hard to know what to do. And the interesting thing I was thinking when Eva was talking about, you know, we know that light at night is bad. We've all got that message. And blue light, especially blue light at night, is bad. Okay, fine. But we're also concerned about not enough light during the day, especially in the morning. So if you have an office worker who lives in Seattle in the winter, northern latitude, gets out of bed, goes into their car, it's night time, they drive in an underground parking garage, and they go into their office, and they sit in their office for 8 hours. They get back in their car and they go home, it's already dark when they get home. They may never get enough light at all to set their clock during the day. So it's not just not enough light, it's also possibly not too much light, it's possibly not enough light. So us lighting designers are trying to like get our head around all this.
So
Let me just,
So the-
one thing is in the last 40 years, we've gone way down with, I mean, we've got way, people are well-intentioned, but we are way worse off than we were 40 years ago.
Well, that sounds, as far as light pollution, that's true, but mainly that's because of lack of understanding and awareness, and people are making decisions about lighting. And most people who make decisions about lighting are not lighting designers. They're basically just electrical engineers or manufacturers and distributors of lighting who are just putting stuff out indiscriminately. And it's been horrible the last 50 years, especially in outdoor lighting. The good thing about LED, and I was thinking when you were speaking, was the new technologies give us a lot of opportunities to do things much better than we could have with conventional sources. In terms of controlling the light, keeping it from going off, and how. I mean, you can do that much easier. And controlling as far as intensity. LEDs are inherently dimmable, so without was basically no additional cost. I mean, compared to old sources, which either couldn't dim at all or were expensive, or complicated. So with the street lighting in Cambridge, for example, that has an adaptive dimming system on it. And at 10 o'clock, most of the lights drop to half their intensity. If we could have done that without LED, it wouldn't have been possible. So that's really cool. But it's making the right decisions. And there's a huge opportunity now to make the right decisions. And I fear that poor decisions are being made, poor choices. But the biggest thing is to just reduce the quantity of light, as far as light at night and outdoor light, just reduce the quantity. We can argue about color and wavelength and shielding and uplighting, but just like stop the overlays.
Ava, were you gonna say something?
Yes, I had to think about this guy Bierbaum who claimed to have some relationship to Edison, right?
Right.
In the movie. And when he was sitting in front of his lamps, and he said, "I don't mind this at all." I had to think he's just treating his seasonal affective disorder.
Carol?
Thank you for remembering my name. I have an offer for everybody here. Cambridge, the city of Cambridge, is about to be presented with a light ordinance to the city council that is seriously deficient. It does not and it will be coming to the city council in June or July. And you all, whoever lives in Cambridge, should be aware of it because it will not regulate rooftop lighting at all. That's what zinc is about. Zinc is these blasting lights on the top of an apartment building on the McGrath Highway that change color and blast into East Cambridge. They were ordered to turn their lights off by the building department. They are appealing that decision on June 16th, on Thursday, at the Senior Center in Central Square. The Board of Zoning Appeal will hear that. If that is approved, that will be Katie bar the door for rooftop blasting lighting all over potentially the city. So number one, you can act on this and not just talk about it. It's going to, if it happens, it's going to flood the city in all kinds of, not in the very exclusive residential neighborhoods, but because we have mixed residences with business, with office, the whole East Cambridge, Kendall Square. These people they live in East Cambridge, and, okay,
Yeah.
that's, so number one, June 16th.
So we actually have a portion at the end where we make announcements about upcoming events
Okay,
and how
just-
people can get engaged. So let's make sure we keep moving this forward and
Okay.
not using it as just a platform for one issue.
It's not just one issue, it's our city. Okay.
Yes.
So anybody who wants to come, you can sign up on my sheet. I didn't come here for this, but I couldn't resist.
Okay. Carol.
I just was reflecting back on the comment about, we're so much worse off 40 years ago, and I agree, but have we done any kind of calculation that correlates population with life? Because the global population has virtually tripled in that time. So as we become more populous and device-driven, to what extent is this escalation in light pollution correlated to escalation in population?
Well, I can answer that. I'd like to answer. There's a study done by Andrea Hicks. University
Tom,
of-
can you speak up?
Sure. It's a study by Andrea Hicks at the University of Illinois, and she predicts a rebound effect in 70 years. So despite all of the energy savings that we're going to have with LEDs, we're going to use more energy than we're currently using. Because it goes back to some of the issues that were presented in the movie, where fear of darkness drives lighting in a variety of different areas for safety reasons. So as you make the technology for lighting cheaper, more people can afford it, and they light more things, and we end up using more energy, even despite the fact that we're more efficient.
I think I have to tell you, just in our practice,
Thank you, Tom.
Just what's going on right now, being installed, interior lighting installations, LED, and controls, and I don't have studies, but I can, just sort of like off the top of my head, are probably using half the energy of, comparable projects we did 10 years ago. So it's easily half, maybe probably a third with controls. As far as exterior lighting, City of Cambridge street lighting, the new lighting uses about 23% of the energy of the old lighting. Now, some of that comes through reduction in overlighting, but a lot of it comes through LED. So it really depends on what the average homeowner will do. I don't know. I went out and bought my LED light bulbs at Home Depot for $3. They use like 7 watts and replace a 60 watt.
The other side of it is that with environmental behaviors, with energy efficiency, people tend to use more energy. They drive the Priuses more because they think they use less energy. So, buildings probably is such a huge chunk of how much lighting is used that people's choices about these things aren't going to, offset it. But you look at now, where we used to have paper billboards or LEDs. LEDs are being put on everything. There's fairy lights around trees. So I think that as it gets cheaper and whatever, that I'm not surprised that there would be a shift, that it could actually go up despite the huge energy savings.
Question here.
So my town actually did pass an ordinance for a dark sky initiative, and there were people working on it.
Which town?
Oh, Lincoln.
Lincoln.
So out in the nice bucolic suburbs. But the town meeting discussion of these guidelines and regulations was surprisingly acrimonious, because people don't like to be dictated to. But they brought up those same, issues of safety. Oh, I need to light up my driveway because, I'm going to have to light my car, or I can't put motion sensors in because the deer are going to set it off. And so you get into all that little minutia, and that makes me think about how you try to write these ordinances to promote change. It's really very tricky. And the other thing they had to do was grandfather in a lot of lighting fixtures. So now, if you change your garage lighting system, you have to comply, but you don't have to change it. So
Interesting.
it's a challenge.
When I saw the film, them talking about how inefficient the lighting is now, like where you can cover the light, I'm curious if anybody knows, like, does that mean we'll save a ton of birds? Like, what percentage of birds will we save? What percentage of turtles will we save? Does anybody have any idea? idea about that? Because it sounds pretty encouraging, just directing the light might have such an effect, but do we know anything about it?
I guess and I don't, Wendy, I don't know if you can answer this from she's giving me the shake off. She's like, don't call on the other button or something.
Yeah.
Kelly.
So most migrating songbirds, believe it or not, migrate at an altitude of only about 300 feet. Wendy, correct me if I'm wrong on that. And so what they run into is not streetlights, but illuminated buildings, right? And so that's a sign of a different problem. And it's one of the things that was very thorny in the discussions in Cambridge in the Outdoor Lighting Task Force, because they're trying to control the outside lights, but it doesn't do much about like a big high-rise that happens to face your apartment, right? Where the lights are on 24/7 inside the lab, for example. So the answer is not until you control all the lighting sources of these big tall skyscrapers, and there's some movement in that direction. The Atlantic Flyway, which is basically follows the East Coast, a lot of the cities during the migration periods have voluntarily created sort of lights out periods where building managers voluntarily turn off the lights to aid in, to be less adverse during the migration season.
So I had two questions too. There's like a flurry of hands happening, and I'm looking past Tilly and Carol directly to Gray.
Apparently she likes to
Well, I'm just curious because, as part of outreach for any of these events, we go tracking down, the butterfly research at the Museum of Science, and the City of Boston and BOMA, stands for
Operator Managers Association.
Right. They have an initiative. I don't think we have anyone in the room though representing that. Are you familiar at all? Like, is this something that's coming up in the built environment space beyond just lighting design? And how is this issue of, it's not just the street lamps, it's not just, what we're doing in residences, but how are we addressing the really big buildings where lights are on all the time?
Well, there's a couple of things that come to my mind where large building operators are trying to look at reducing lighting and light pollution. In addition to having times of the year when people are trying to shut off buildings more comprehensively at nighttime, one way that building operators are looking to be able to do that is to change the time of day that cleaning and janitorial services happen in the buildings. That's one reason it drives late night lighting of buildings. So talking with tenants about welcoming the cleaning services into, starting at 4 p.m. instead of starting at 8 p.m., things like that. So any tenant in any large building could try to approach their facility manager with that type of request. And then, of course, one of the programs that we support at USGBC is the LEED building rating system, which does have a point for improved light pollution reduction. And so you can dig into that if you have a project that's going for LEED certification and look at how that can help guide some of the choices being made by lighting designers and other people involved in the project.
Well, and that would have an interesting side benefit as well for the folks. I mean, certainly it doesn't go into depth, but folks who are in custodial services often work at night are going to be as subject to, the cancer risks as nurses and others who are working a night shift. So it's a nice added benefit. Carol, are you raising your hand?
Because I have a question, yeah.
Okay.
And it's not unrelated to what my friend Bob was asking. I'm on the end of life kind of girl, What happens to LEDs when they don't work anymore? How do they get handled?
What happens to LEDs at the end of life?
Just having this conversation this afternoon, in fact. Recycling is, we will always say recycling is the most responsible method for disposal. And there is an industry that handles electronic waste, mercury-containing lamps, a whole bunch of other things, and I was asking them today, can you again confirm to me that you can handle LEDs? They said, absolutely. We handle them just like electronic waste. We dispose of them properly, we pull apart whatever we can salvage and sell whatever materials are in there. But yes, they can be recycled, and we are just starting to see the need for it.
Okay, call me
Is that your
skeptical. Here's why.
Yeah?
Recycling only works if there's an economic value to the recycler. So I'm trying to understand what value is coming out of that little thing you passed around.
Nothing.
Right. So,
Mhm.
so that's why I was skeptical. And when I said safety, it comes from that CFL problem we have. You know, people didn't understand they were bringing mercury into their home. Nobody knows how to deal with a broken CFL. And I don't think that people who are buying the LEDs are necessarily doing anything to recycle.
No, I agree.
They're putting them in with the CFLs, because that's what I'm seeing, already seeing, I'm getting LEDs that actually still work. People are disposing of them. I don't know if they changed the style of light, or they just appear. In Bedford, I have a kiosk for lamps and batteries, and I'm getting LEDs. Don't know what to do with it.
So, I mean, the waste stream on LEDs is going to be a lot less than conventional lighting, because we don't have light bulbs that burn out. So eventually something may.
Wait, okay.
So you got LED light bulbs, right? They're going to last a long, long, long time. I'm just saying, so the waste stream is going to be a lot less. You're not going to be changing a light bulb every 6 months. You're going to be changing it every whatever. Who knows? 20 years, 6 years. We don't really know yet exactly. And then on LED luminaires that don't have a light bulb to change, like the street lights in Cambridge, those are basically pieces of electronics that can be handled like electronic waste. Cambridge is not going to change out, not going to replace those fixtures. And I can tell you right now, they've been out for 2 years and installed, and I think they've had 0 failures in 5,000 street lights installed. So that's pretty good. So eventually, they're not going to change them until some other technology comes along that's so much better. And if they do, then they go to recycling and get processed like your computer, hard drivers.
And the old technology, as you saw there with like the radiator, the early LEDs, which are starting to be recycled now, had the heavy heat sink, and that was a chunk of aluminum, which is valuable. And the recyclers love the old LEDs because they can make money off of them. Luminaires, integrated luminaires, same thing. It's metal that they can recycle and sell. It's 10 years from now, 15 years from now, that is going to be a different story.
Where's all the sodium metal coming from, and all the energy that's being used to dehydrate the air around the sodium so it doesn't blow up on Cambridge Street? Cambridge has
Bob,
transportation.
Yeah, there was another question here first. I have to be respectful too of that.
Well, one issue, as you mentioned that you have a product that failed.
I've had 2 LED lights.
Right, so
that
I
last
looked
less
at the studies that relate to the longevity for LEDs, and of course they last a lot longer. 50,000 hours is a typical number that's used. The failure rate is highly dependent on the switching. And on a commercial basis, on a street light basis, where the light is turned on once a day and turned off once a day, that light will last forever. And the bulk of the light bulbs throughout the world that will be installed in the next years are going to be in commercial and industrial settings where they'll have limited switching. So they'll last forever. I mean, not forever, but they will last at 50,000 hours. That's rated.
So I'm going to ask Jen to respond to that. I'm also going to ask you to respond to Bob's question if you know the answer to it about what supply chain, where it's coming from, and then you can ask your question and then do a time check.
Okay, it's actually more Steve. Okay.